We will start talking about stress tests, and are they really that necessary? So as you remember, the front page for that article in the Washington Post was titled, "Questions Grow About the Need for Cardiac Stress Tests," and it was published on June 13th. For decades, cardiac stress tests have been the go-to test for detecting heart disease. Heart attacks happen when blood flow to the heart is suddenly interrupted by a clot, not by a plaque. Once you begin to understand that one fact, then you begin to understand why stress tests don't really predict heart attacks. Cardiologists treat heart attacks with medications and procedures. Stents do work if you're treating a heart attack. 90% of stents are done for plaque, and they don't work. They don't prevent a heart attack. The doctor remove a clot if you're having one. In other words, yet again, it's not the plaque, it's the clot that causes the heart attack. So, for people who are not in the midst of a heart attack but have a positive stress test, the usual advice was to open up those narrowed arteries, squeeze out that plaque a little bit more. And that, again, has been demonstrated with ORBITA trial, COURAGE trial, ISCHEMIA trials, multiple trials. That's not doing the trick. The idea seems logical. If you have blockage, then spread it out. Open that up. But again, all of that logic is based on the assumption that the plaque itself is slowly squeezing off the artery, and that's not what's going on. So this has led to over 8 million nuclear stress tests per year to detect blockage and invasive procedures to open and bypass those blockages. In the past couple of months, though, many elective procedures have really plummeted because of the social shutdown, the concerns, the risks associated with COVID. If stress tests were that important to protect your health, to protect you from having a heart attack, you would think that those stress tests would have continued on. Now, if you read this article in the Post, again, it's a physician, he's very well aware of what's going on, and he's making the point. Yes, some of this might just be the straw event for stress tests. There is huge financial reasons that the medical industrial complex continues to push stress tests, despite the fact that the science is becoming clearer and clearer that they don't do what we hoped they would do. So you've got the ORBITA trial, you've got the COURAGE trial, you've got these trials going on, you've got docs looking at decreased income. What do? Well, when something comes along like a pandemic, maybe you go ahead and make that change. You see, stress tests require 50% or more blockage to show a problem. 68% of heart attacks occur in people with less than 50% blockage of flow. This only leads to false negative results. So you go in, you've got a little bit of plaque. It's not enough to block the flow. You do fine on it. You go back out. Even though it was only a small amount of plaque, that plaque happened to be inflamed. It leaks back out into the blood system, causes that clot. The clot releases and stops blood flow to the heart. And that's exactly what happened to Tim Russert. I believe it was Friday the 13th of June, 2010 or 2011. 30% of positive stress tests are false positives. False positive meaning like they're not going to have a heart attack. False positive stress tests unnecessarily lead patients to the cath lab. The invasive procedures that come from the cath lab are expensive and uncomfortable, and most of the time, cardiologists will go ahead and have the patient sign up to get a stent. You know, we're about to do the cath. We're about to find out if you have plaque. While we're in there, let's just go ahead and do the stent if I think we need one. And the patient signs off for it. And again, so there you begin to see how the stress test takes the patient and the doctor down that pathway. Stress test, cath lab, angiogram, and then a stent. Plaque detected during cardiac catheterization is the reason stents are placed. While 90% of stents are placed to prevent a heart attack, multiple studies have shown that they don't do that. They don't prevent heart attacks. Evidence indicates that opening arteries as a preventive measure in people who are not experiencing a heart attack doesn't produce the benefits. In 1988, John Ambrose, who was a cardiologist at Mount Sinai in New York, all the way that far back, he and his colleagues found that heart attack often didn't occur where the blockages had been severe. They occurred in other places. again, once you begin to understand the mechanism, it becomes clear why he found that. That was the truth. In 2007, the COURAGE trial reported the procedure to place a stent and unclog arteries failed to reduce the risk of death or heart attacks or other events. The COURAGE trial, I think, was reported in the New England Journal. And actually, the day that they announced Tim Russert's death, they talked about the COURAGE trial. In 2018, ORBITA study was done. It was actually a sham procedure. It was done in England. The human subjects reviews wouldn't let them do that in the United States. What they actually did was they took people where their docs had said, look, you've got the indications to have a stent, but we're going to do a randomized clinical trial. They took them into the surgical room. They prepped them for surgery. They even put them to sleep, but only half of them actually got the stent. The other half did not. Guess what happened? Same amount of heart attacks, whether you had the stent, whether you didn't. Now, when I start talking about these studies, I usually get a lot of haters coming in and saying, you can't tell me my stent didn't work. I'm not telling you your stent didn't work. Also, I'm not telling you that stents don't help for a heart attack. If the stent is used to remove the clot during a heart attack, it absolutely helps. But that's only 10% of stents. Another place where stents can help would be they can often result in decreased, significant, or severe angina. But 90% of stents, again, are placed to prevent a heart attack. They don't do that. Now, in 2020, another trial was done. Up until that point, they said, well, okay, maybe stents don't prevent heart attacks, but we know that bypass surgery does. CABG, coronary artery bypass grafts. 2020, I think, again, also New England Journal. ORBITA was in, I think, Lancet. It was an English study. 2020, again, I think in the New England Journal. They looked at mostly bypass and they found the same thing. Bypass does not prevent a heart attack. So this is a little bit deeper into the ischemia trial. Again, New England Journal, 5,179 patients, moderate to severe ischemia. In other words, restriction of blood flow to the tissues in the heart. Randomly assigned to invasive strategy, which included angiography, going to the cath lab, revascularization when feasible, in other words, stent and or bypass, or a much more initial conservative strategy, medical therapy alone, angiography if the medical therapy failed. The outcome? In terms of death from cardiovascular causes, myocardial infarction, or hospitalization from unstable angina, heart failure, or resuscitated cardiac arrest, no difference in any of those significant areas. So the study put into the question, how valuable are bypass grafts? How valuable are stents? And therefore, how valuable is a stress test? Because you get started down this road by getting that stress test. Now, again, if you've got more interest in this topic, in this space, that's what the book's about. It'll be coming out again over the next 4 to 8 weeks. It goes into all of the different ways of predicting heart attack, measuring plaque. The title of the book is Prevention Myths: Why a Stress Test Can't Predict a Heart Attack and What Other Tests Can. So, COVID-19. This gets back to that last article from the Washington Post on June 13th. How did COVID affect all this? The COVID pandemic has forced a change in practice, at least for the past few months. Some people have deferred needed tests, but there are others whose tests may no longer be useful. In the midst of one of the most dramatic reversals of practice that we have seen in a long time, this may actually be an opportunity to improve clinical care. There are still some reasons for stress testing, such as diagnosing angina, but the ischemia trial should reduce the use of treadmills and other tests. Hopefully, they will never return to their prior level of use. And according to the Washington Post, Harlan, I'm blanking on his last name, that would be a good thing to come out of the epidemic. And guess what? I guess it's pretty clear I agree with him. Hey, test, don't guess. For $199, including labs, we can get a full-blown insulin survey, like the Kraft insulin survey with oral glucose tolerance. Check it out.